Okay, good afternoon, and thank you for joining our briefing on the City of Philadelphia's response to COVID-19. This is for press only, and if you are not a member of the press, please log out and watch on one of the live streams. We will begin our briefing with opening remarks from Mayor Kenney. Mayor, you have the floor.
Thanks, Mike, and good afternoon, everyone. Today I'm speaking to you from home because I'm again in quarantine after being exposed to someone who tested positive for COVID-19. You may recall I also quarantined back in mid-September for 2 weeks. I'm free of any symptoms and I'm planning to get tested soon. Like the last time, I mentioned this not to focus on myself, but to remind everyone that the virus is still here and we must remain vigilant. So if you find yourself in a similar situation, exposed to someone who tests positive, do the right thing and self-quarantine. I'm adhering to the CDC's latest guidelines to quarantine for 10 days unless I get a negative COVID test after 7 days. We're still working very hard to flatten the curve, and self-quarantining is a crucial way that anyone who's been exposed can help to accomplish. On a different safety-related topic, I want to reinforce a message our fire department shared this afternoon at their Christmas tree safety tips demonstration. Now is the time of year when many Philadelphia families are bringing Christmas trees into their home. A Christmas tree, for those who celebrate, is certainly going to bring some welcome cheer into homes as we close out this tremendously difficult year. But a safe holiday season means properly choosing and caring for natural cut Christmas trees. So please remember these basic tips from the great members of the fire department. Buy a tree with fresh needles that don't fall off when touched. Cut 2 inches off the base of the trunk to allow the tree to better absorb water from the tree stand. Water the tree daily because dried out trees are a fire hazard. Don't place your tree near exits, stairs, or heat sources. If you use tree lights, make sure they are designated for indoor use and that the cords are not frayed. And never leave lighted trees unattended. We hope that this holiday season is magical for everyone, so we need to avoid any such potential tragedies. And now Dr. Farley has his update on COVID-19. Doc?
Thank you, Mayor. Unfortunately, we are seeing a spike in case counts from the coronavirus infection here and across the United States to record highs, likely caused by social gatherings that happened over Thanksgiving, on top of already high case counts. So this is an extremely dangerous period in this epidemic. I can't emphasize enough the importance of people following safety precautions now. Here are the numbers. Since this time yesterday, we've identified 1,408 new cases of the coronavirus infection in Philadelphia residents by the PCR test, the regular test, bringing us to a total of 75,458 since the beginning of the epidemic. And in addition, 108 new probable cases diagnosed by the rapid antigen test. Now, we're having delays in laboratory reporting results to us, and it makes it difficult for us to follow the trends in the epidemic. But the pattern we're seeing is clearly a decrease in the number of cases daily before Thanksgiving, followed by a sharp increase after Thanksgiving. So let me give you a sense by looking at the past 3 weeks. For the past week, November 29th through December 5th, we averaged 910 cases per day so far, but we expect more to be reported in the future. And of the people tested last week, 12.7% tested positive. Now, the previous week, November 22nd to November 28th, we averaged 820 cases per day, and 10.6% of the people tested positive. The week before that, November 15th and November 21st, we averaged 951 cases per day and 11.1% tested positive. So you can see the cases were falling until late last week, and then there was a sudden increase. Now, while the increase in cases in Philadelphia was big, the spike was even bigger elsewhere. In Pennsylvania as a whole, they were reporting some 5,000, 8,000 cases per day through the end of November. Then on November 3rd and 4th, they reported more than 12,000 cases each day. Now, the United States as a whole, it has now hit an all-time high of more than 200,000 cases in single days late last week. Why are we seeing this big increase? Well, the answer is Thanksgiving. The spike in cases happened suddenly in most states in the United States at the same time. And the cases started about 5 days after Thanksgiving, which is the typical length and incubation period for the coronavirus. And then we have plenty of stories from our case interviews of people that got together or Thanksgiving gatherings. So here's one, for example. There's a woman named Maria. That's not her real name, but the purpose of this, Maria. It's a woman in her 20s. She had symptoms the day before Thanksgiving. She gathered with 10 family members on Thanksgiving anyway. And after Thanksgiving, she went in and got tested, and she tested positive. Shortly thereafter, her family members started developing symptoms, and at this point, at least 7 others at that gathering have already tested positive. Stories like that happen across the city, across the state, and across the nation. Now, back here in Philadelphia, what's happening in nursing homes? We're continuing to see clusters of cases in them. For the weeks of November 15th and November 22nd, we were at more than 160 cases each. That's not as high as we saw in the spring, where we saw more than 700 cases in a single week. But a big increase from the 10 to 15 cases per week we saw in the summertime. And we now have 50 nursing home residents with COVID in our COVID relief unit, where they're in part to protect the other residents in the nursing homes where they got their infection. What about our city's hospitals? Well, the number of people hospitalized with COVID is still growing in the state of Pennsylvania and Philadelphia. The state of Pennsylvania as a whole is growing very rapidly. There were more than 5,400 patients with COVID in hospitals yesterday. 2 weeks ago, that was 3,400, so risen more than 2,000 in just 2 weeks. And that 5,400 is nearly twice as high as the peak of 2,800 saw last spring. Back here in Philadelphia, there were 886 patients hospitalized with COVID this morning. That's an increase of about 200 from 2 weeks ago. And the hospitals are clearly showing signs of strain. Now, they have enough beds, but they're having difficulty maintaining staffing. In the past 2 weeks, the epidemic has been worst in the northeast section of Philadelphia, so the hospitals in that area have been particularly hard hit. Hospitals are talking to each other, and they'll be moving patients around as necessary, even the load. What about deaths? Well, unfortunately, I have to report that since yesterday, we've identified 52 deaths from the coronavirus among Philadelphia residents, bringing us to a total of 2,107 since the beginning of the epidemic. Now, our data from deaths is typically delayed, and it often comes in batches like that. But overall, there's clearly a sharply rising trend. For the week of November 15th, there were 47 deaths so far. The week of November 22nd, there were 65 deaths so far, but we expect more. This is a big increase from the 10 deaths per week we saw in September. We're on track to have several hundred more deaths before the end of the year. What about testing? Well, with increased demand through testing, our testing sites are busy. Appointments are difficult to get at some of our sites, and the laboratories are backed up, and so to a certain extent, there are delays in getting test results. On average, maybe 3 to 4 days. At some laboratories, people get the results instead of 1 to 2 days. There's some people we've heard that have gotten the results back as late as 7 days after they were tested. So during this time when it may be difficult for people to get tested, it's important for people to remember the priorities. It's most important for people to be tested if they have symptoms or if they've been exposed to COVID. For others, remember, testing is not a substitute for wearing masks and keeping distance from other people. Because if you test positive, you need to wear a mask and stay away from others. And if you test negative, you need to wear a mask and stay away from others. Testing is not a substitute for mask and distance. Now, as the mayor mentioned, there are now new recommendations from the Centers for Disease Control on the quarantine period. Previously, if you're exposed to someone with COVID, the recommendation was to quarantine for 14 days after the last exposure. With the new guidance, if you're exposed, you should quarantine for 10 days after the last exposure. Or there's an option that you can end a quarantine after 7 days if you have a negative test. That test can be no more than 48 days old. The rationale here is that there are very few people will turn positive after more than 10 days since exposure. Some, but not many. And if the quarantine period is shorter, 10 days instead of 14, we hope that more people will stick with it. Philadelphia will follow this CDC guidance, and it's our shortened summary of it is posted on our website. Now, overall, we hit some pretty grim milestones last week. So it's worth thinking how severe this epidemic has been in the city. We now have more than 75,000 people who've been infected with this virus, nearly 10,000 people who've been hospitalized, and more than 2,000 people who have died just in 9 months. The epidemic has touched us all. Everyone knows someone who's been infected. About half of Philadelphia residents know someone who's been hospitalized, and it's very common for Philadelphia residents to know someone who has died. Unfortunately, even though it's been 9 months, the epidemic is not in the past yet, not at all. Most people in Philadelphia are still susceptible to this virus, still susceptible to this infection. There are still many more people who could get infected, who could become hospitalized, and who could die if we don't prevent the virus from spreading. Now we have more holidays coming up. And in the past holiday, I believe most people followed our recommendations to not have large family gatherings, but too many people didn't. And we can't afford to have more case spikes like this Thanksgiving spike. We just can't afford to do that. Which brings us to our restrictions. Our safer at home restrictions rules went into effect on November 20th. They are in effect at least through January 1st. Remind people that means no indoor gatherings, no indoor dining, no indoor sports, no indoor gyms, museums, or libraries. And for retail stores, people are required to wear masks, and there's a limit on the number of people in the store of no more than 5 per 1,000 square feet. Detailed guidance for all different settings that we have guidance for is at our website, www.phila.gov/saferathome. I believe these restrictions prevented the increase that we saw last week from being even worse. So we're asking everyone to take them seriously, to follow the rules and follow the recommendations. Now, let me end on a little more hopeful note about vaccination. The FDA is reviewing results of the studies of these 2 vaccines right now. And they apparently just released evidence of one of the trials this morning. I've not had a chance to review it yet, but I'm hopeful about that. If that first vaccine, that's the vaccine produced by the Pfizer company, if it's approved later this week, we are likely to start offering that vaccine here in Philadelphia next week. And the second vaccine coming down the pike, Moderna vaccine, could possibly be approved a week later. And if so, then we may start vaccinating with that the following week. And with both of these vaccines, we will have limited doses. And our first priority group is going to be healthcare workers who are routinely exposed to coronavirus. And we'll widen the group that gets vaccine as more vaccine becomes available in the coming weeks and months. So what should everyone do in the meantime? It's safer at home. Stay away from people other than your household members. Work from home unless it's impossible for you to work from home. And when you're around anyone who's not a household member, make sure you wear masks. Our website with all this information is www.phila.gov/COVID. Thanks.
Thank you, Dr. Farley. Now let's go to Armando for the Spanish language translations of the mayor's and Dr. Farley's comments.
Palabras del alcalde Jim Kenney para el 8 de diciembre de 2020. Buenas tardes a todos. Hoy el alcalde Kenney les habló desde su casa, ya que nuevamente está en cuarentena, luego de haber estado expuesto a alguien que dio positivo al COVID-19. Como pueden recordar, él también se puso en cuarentena a mediados de septiembre. No tiene ningún síntoma y planea hacerse la prueba pronto. Este es un recordatorio para todos que el virus todavía está aquí y que debemos permanecer alerta. Entonces, si usted se encuentra en una situación familiar, ha sido expuesto a alguien que dio positivo, haga lo correcto y póngase en cuarentena. Adhiérase a las últimas pautas de los Centros de Control de Enfermedades o CDC sobre la cuarentena durante 10 días, a menos que venga una prueba de COVID negativa después de 7 días. Estamos trabajando mucho para aplanar esta curva y la autocuarentena es una forma crucial de ayudar para cualquier persona que haya estado expuesta. En un tema diferente relacionado con la seguridad, quiero reforzar un mensaje que nuestro Departamento de Bomberos compartió esta tarde en su demostración de consejos de seguridad para el árbol de Navidad. La época del año en que muchas familias de Filadelfia están llevando árboles de Navidad a sus hogares. Un árbol de Navidad, para aquellos que celebran esta fecha, sin duda traerá un poco de alegría a los hogares a cerrar este año que ha sido tremendamente difícil. Pero una temporada navideña segura significa elegir y cuidar adecuadamente los árboles de Navidad naturales. Por lo tanto, tenga en cuenta estos consejos básicos de los miembros del Departamento de Bomberos de Filadelfia. Compre un árbol con ramas frescas que no se caigan al tocarlas. Corte 2 pulgadas de la base del tronco para permitir que el árbol absorba mejor el agua. Riegue el árbol a diario, porque los árboles secos representan un peligro de incendio. No coloque el árbol cerca de salidas, escaleras o fuentes de calor. Si usa luces para decorar su árbol, asegúrese de que están diseñadas para uso en interiores y que los cables no estén desgastados. Y nunca deje los árboles iluminados sin vigilancia. Queremos que esta temporada navideña sea mágica para todos, por lo que debemos evitar estas posibles tragedias. Y gracias a todos por su cooperación. Y esta es la actualización en materia de salud para el día 8 de diciembre del 2020. Es importante destacar que ha habido un aumento impactante en los casos reportados, no solamente en Filadelfia, sino en todos los Estados Unidos. Esto probablemente se deba a las reuniones sociales por el Día de Acción de Gracias. Este es un periodo extremadamente peligroso. Y comenzamos con los números. Reportamos 1.408 casos nuevos. Estos resultados se han obtenido a través de las pruebas de PCR. El total de casos al día de hoy es 75.458 casos. Reportamos también 108 casos probables por las pruebas rápidas de antígenos. Los retrasos en los laboratorios hacen que las tendencias sean difíciles de seguir, pero el descenso de los casos antes del Día de Acción de Gracias fue seguido de un gran aumento. La semana del 29 de noviembre al 5 de diciembre, el promedio fue de 910 casos por día, aunque esperamos que este número aumente. El 12,7% de los casos han resultado positivos. La semana previa, del 22 de noviembre al 28 de noviembre, el promedio de casos fue de 820 casos diarios y el porcentaje de casos positivos fue 11,1%. Los casos fueron descendiendo hasta el final de la semana pasada y luego hubo un incremento súbito. Mientras que el incremento en Filadelfia fue grande, en otras partes ha sido aún mayor. A fines de noviembre, en Pensilvania, estábamos recibiendo informes de 5.000 a 8.000 casos diarios, pero el 3 y 4 de diciembre se reportaron más de 12.000 casos por día. Al final de la semana pasada, en los Estados Unidos, alcanzamos el mayor número de casos reportados, con más de 200.000 casos diarios. ¿Por qué pasa esto? Primero, por las reuniones del Día de Acción de Gracias. El aumento en los casos ocurrió repentinamente al mismo tiempo en la mayoría de los estados de los Estados Unidos. Los casos comenzaron a reportarse unos 5 días después de la duración del periodo de incubación. Y muchas entrevistas nos revelan casos en que el contagio se produjo en las reuniones por el Día de Acción de Gracias. Por ejemplo, María, y este es un nombre ficticio, una mujer de 20 años, presentaba síntomas el día anterior al Día de Acción de Gracias. De todos modos, ella compartió la celebración de Acción de Gracias con 10 miembros de su familia. El día después del Día de Acción de Gracias, María dio positivo a la prueba y poco después otros desarrollaron síntomas. Y al menos otras 7 personas que participaron en su celebración han resultado positivas al COVID hasta ahora. En las casas hogares se continúa viendo también el aumento de los casos. Para la semana del 15 de noviembre al 22 de noviembre se reportaron 160 casos por semana. No es tan alto como el repunte que tuvimos en la primavera, en el cual reportábamos 700 casos semanales. Pero sin embargo, este es un gran incremento de los 10 a 15 casos semanales que tuvimos entre agosto y septiembre. Hay 50 residentes de las casas de ancianos que están en la unidad de alivio y prevención del COVID. En cuanto a los hospitales, el número de pacientes hospitalizados con COVID sigue creciendo en Filadelfia y también en Pensilvania. Los números han ido subiendo, 5.400 el día de ayer, cuando hace 2 semanas eran 3.400 personas hospitalizadas. Esto es casi el doble del pico de la primavera, fue de 2.800 casos. En Filadelfia, al día de ayer, 886 personas fueron hospitalizadas por el COVID. Este es un aumento de aproximadamente 200 personas con respecto al número que teníamos hace 2 semanas. Los hospitales tienen suficientes camas, pero hay dificultad para mantener el personal necesario. En las últimas 2 semanas, la epidemia empeoró en el noreste, por lo que los hospitales en esa área de Filadelfia se ven particularmente afectados. Los hospitales van a reubicar a sus pacientes para nivelar la carga según sea necesario. Con respecto a las muertes, hoy reportamos 52, con un total de 2.107 personas fallecidas. Estamos recibiendo los datos con retrasos, ya que estos vienen en grupos, pero la tendencia apunta al incremento de estas cifras. La semana del 15 de noviembre se reportaron 47 muertes. La semana del 22 de noviembre, 65 muertes semanales hasta ahora, pero esperamos que todos estos números suban. Y todo esto refleja un incremento en relación al número que se reportó en septiembre, que era de solo 10 muertes semanales. En cuanto a las pruebas, hay una mayor demanda de las pruebas y por lo tanto los sitios de pruebas están bastante ocupados. Hay retrasos para obtener citas porque es difícil obtenerlas. Hay retrasos también para obtener resultados que pueden tardar de 3 a 4 días en lugar de 1 a 2 días. Las pruebas son más importantes para aquellos que tienen síntomas, para aquellos que han estado expuestos. Para otros, recuerde que las pruebas no son un sustituto de las máscaras y de la distancia social. Si su prueba sale positiva, usted necesita usar su máscara y mantenerse alejado de los demás. Si la prueba sale negativa, necesita usar su mascarilla y mantenerse alejado de los demás. Repito, las pruebas no sustituyen las máscaras y la distancia social. Hay también nuevas recomendaciones de los CDC respecto al periodo de cuarentena. Previamente, si estuvo expuesto, debía guardar cuarentena por 14 días después de su última exposición. Según la nueva guía, si está expuesto, debe guardar cuarentena durante 10 días. Y puede finalizar la cuarentena después de 7 días si la prueba es negativa. Pero la prueba no puede tener más de 48 horas. La justificación para este cambio es que hay muy pocas personas que se vuelven positivas después de más de 10 días tras su exposición. Y si el periodo de cuarentena es más corto, esperamos que más personas cumplan con ello. Y Filadelfia seguirá esta guía. Hemos alcanzado varios hitos sombríos la semana pasada. Vale la pena pensar en la gravedad de esta epidemia. Más de 75,000 casos, casi 10,000 personas hospitalizadas y ya sobrepasamos las 2,000 muertes. Esto nos ha tocado a todos. Todos conocen a alguien que ha estado infectado. Aproximadamente la mitad de los residentes de Filadelfia conocen a alguien que ha sido hospitalizado. Es común que los residentes de Filadelfia conozcan también a alguien que ha muerto por el COVID. Desafortunadamente, a pesar que han pasado 9 meses, la epidemia aún no ha concluido. La mayoría de las personas en Filadelfia todavía son susceptibles y todavía hay muchas más personas que podrían infectarse, ser hospitalizadas o morir si no evitamos que el virus se propague. Y se nos acercan las celebraciones de diciembre y no podemos permitirnos tener más picos de casos como el pico que hemos tenido por el Día de Acción de Gracias. Con respecto a las restricciones, las reglas de más seguro en casa seguirán vigentes hasta el 1 de enero. No se permiten reuniones en espacios cerrados, ni cenas, ni deportes, gimnasios, museos o bibliotecas. En el caso de las tiendas, se requiere el uso de las mascarillas. Hay un límite en el número de personas que es de 5 personas por cada 1,000 pies cuadrados. Hay orientación detallada que puede encontrarse en Filadelfia, fila.gov/safer at home. Creemos que estas restricciones evitaron que el aumento de la semana pasada fuera aún peor, y les rogamos a todos que se tomen en serio el virus y que cumplan las reglas y las recomendaciones. Pasando al tema de las vacunas, la Administración de Alimentos y Medicamentos está revisando los resultados de los estudios ahora. Si la vacuna de Pfizer se aprueba a finales de esta semana, es probable que comience a vacunarse la próxima semana. La vacuna de Moderna posiblemente será aprobada una semana después y se podría empezar a vacunar en 2 semanas. Quiero ser enfático. Tendremos dosis limitadas en esta primera etapa. Los trabajadores de atención médica que se exponen habitualmente al COVID tendrán la primera prioridad. Ese criterio se ampliará cuando haya más vacunas disponibles en las próximas semanas y meses. ¿Qué deberían entonces hacer los habitantes de Filadelfia? Quedarse en su casa. Están más seguros allí. Trabajar desde casa a menos que les sea imposible. Y cuando esté cerca de alguien que no sea miembro de su hogar, por favor, use una mascarilla. Muchas gracias.
Okay, thank you, Armando. And we're now going to move to the Q&A portion for members of the press. And today we are again joined by Managing Director Umar Alexander. Because of limited time, only one representative from each media outlet is permitted to ask questions in the initial round, and reporters are asked to limit their questions to 3 or fewer. We are limiting the first round of questions to the topic of COVID-19. So if you have questions on other topics, please hold them for a second round if there is time. And if your hand is raised now and it's not about COVID, please lower it, and we will let you know when we open it up to broader topics. For now, let's get started with Jeff Cole of Fox 29.
Yeah, all for Dr. Farley, 3 for Dr. Farley on COVID. Dr. Farley, yesterday the governor of Pennsylvania said that he may impose new restrictions and will make the decision fairly soon. He, like you, have raised concerns about hospitals. Dr. Farley, from what you've seen, do you see a need for further restrictions throughout the Commonwealth and in the city of Philadelphia? Do you think you're close to that in any way?
Well, when we put our restrictions in place, we did recommend that other areas around us put in place similar restrictions. And I do think that's necessary right now. I don't know that we need to put in additional restrictions in Philadelphia, but I do think having consistency of the restrictions across the rest of the state would be very valuable, even to us in the city.
Did you actually have contact with Delaware County and Chester County and Montgomery County? Did they refuse to do that when you asked them? I remember you asking that you were going to say that you wanted that. Did they refuse that?
It wasn't a refusal, and I did not talk to them directly about it. But I think that there may be some questions in their mind about their legal authority to do that.
Okay. You've talked about, you said if it's approved this week, the Pfizer vaccine, we may see it next week. You may have been asked this, but Governor Murphy has actually laid out specific numbers of doses that he expected the state to get. Do you have a number for the number of doses you expect to get in the city of Philadelphia if it's approved this week?
Yeah, unfortunately, we don't. We've gotten many numbers from the federal government, but each one of them, they say it may change, and those numbers frequently have changed. So we won't know how many doses we get until we actually get them.
Are Temple and Einstein...
All right, thank you, Jeff.
Thank you.
We're going to go to Brandon Hudson of NBC 10.
Hey, good morning or good afternoon. Sorry. Good afternoon, everybody. I just had 3 questions for Dr. Farley. You had mentioned the vaccine approvals with the vaccine doses possibly being available as early as next week for Pfizer, then the week after that for Moderna. Is that going to be like I guess, how do you administer that? Is it like where can people get it, and how is it going to how are people going to be able to go get these vaccines?
So that the first group are going to be healthcare workers who are routinely exposed to COVID. Those fall in a few categories. They are people who work in hospitals. They're people who work in nursing homes. They're people who work in other facilities. So there's going to be a different mechanism for distributing that according to where those healthcare workers work. For hospitals, we will give the vaccine to the hospitals and they will vaccinate their own staff. We will have people who go into nursing homes to vaccinate nursing home staff. We'll come up with other mechanisms for people who are not affiliated with those large institutions.
How realistic are you looking at as far as getting through all 4 of the phases from phase 1 to phase 4, and how soon can that happen?
Well, there are 3 phases. There's 1A, 1B, and then 2 and 3. But that really depends on how quickly the manufacturers can produce doses and deliver them to us. We have some sense of how many they can deliver before the end of the year, but we really haven't got much information about how quickly we will get additional doses through the first part of 2021. I think that we can probably administer them and distribute those doses in Philadelphia as quickly as they can produce them. But we just don't have good information about how quickly they can produce them.
All right, and last question, just talking with people in Philly and in the suburbs, would Philly be the first place to get it and then it's the surrounding suburbs? Or have you talked about how that plan will happen?
So the vaccines are distributed from the Centers for Disease Control, and they go in general to state governments to distribute across their state. However, there are a few big cities that get vaccine directly from the CDC, and Philadelphia is one of them. So we'll get vaccine to cover the city of Philadelphia, and then the state government in Harrisburg will get vaccine to cover the rest of the state of Pennsylvania, and those vaccines will come out at the same time.
All right, thank you.
All right, thank you, Brandon. Let's go to David Murrell of Philadelphia Magazine.
Hi, first question for Mayor Kenney. I just had a sort of big picture philosophical question about strategy in terms of combating the pandemic. So, in Europe, different countries have sort of kept schools open while closing businesses totally during their most recent lockdown, whereas, in the US and including Philadelphia, the latest restrictions haven't been quite as severe, but schools are still closed. My question is, how much of the decision-making there and the distinction between what's happening here versus in Europe is simply different public health calculus, and how much of it is, for instance, an acknowledgement of the sort of revenue situation in Philadelphia where absent federal support, the city can't necessarily afford a wider shutdown this time around?
I believe that all of our decisions were made based on science and medicine. I take my advice from Dr. Farley and the other public health professionals, and there's really been no other oculus to look at it through.
So do you, in terms of I guess I'm also just interested too then, given that, schools have obviously been closed for a long time and there were restaurants open at least until the latest round of shutdown. I mean, maybe this is a question for Dr. Farley then, but could you just give a kind of comparison of, does that reality mean that schools are then taken to be more dangerous vectors of spread compared to restaurants?
Well, just to clarify something here, it's always been our position that schools in Philadelphia can be open if they follow safety precautions. We have allowed the schools to be open until the most recent restrictions where we said that high schools need to go online only. But there are schools that have been open since the beginning at the elementary, middle school level, and we're working closely with them. We do think that having schools be open and children being educated is important. And we have noticed the European model that they have been able to control this epidemic by shutting down a number of businesses and allowing schools to be open. And so that was a model that we looked to in coming up with the restrictions that we used here.
Just the last question, as it relates to vaccination, do you have any sense of sort of where teachers would fall on that prioritization list? And if the school district of Philadelphia is sort of thinking of reopening if that would be tied in any way to vaccination of teachers or not and staff?
I think it's too early to say that. I will say that there is sort of second category workers that are called essential workers or critical infrastructure workers. So workers who have lots of contact with other people are going to be in that group. So if there are teachers who are actively teaching, then it would make sense that they would be in that. But we haven't fully defined who's in that full essential worker or critical infrastructure worker group yet.
Thanks.
Thank you, David. Let's go to Jack Tomczyk of the Metro.
Hello, everyone. These questions are for Dr. Farley. Just wondering, do you have any idea of the capacity to store the vaccine in the city of Philadelphia? Because I know if it needs to be stored for long periods, it needs to be in ultra cold freezers.
Yeah, capacity for storage is not a problem here. We have a few freezers in the health department, and there are freezers in hospitals across the city that do ultra cold, and the vaccine doesn't take up a lot of space. I should point out a tray of the vaccines that has about 1,000 doses has been referred to as the pizza box, to give you a sense of how big it is. It's not that big, and you don't have to have many of those trays to get to 40, 50,000 doses. So storage is not a problem.
Okay, thank you. That was my only question.
All right, thank you, Jack. Let's go to Maggie Kent of 6 ABC.
Good afternoon, everybody. My question is for Dr. Farley as well. It's in regards to hospitalizations and the numbers that we're seeing there. I understand you mentioned that hospital bed capacity isn't a concern. Do you forecast or project that being a concern? You did mention, however, staffing is a concern. Are you seeing that there is enough PPE for staff, that staffers are being exposed at a higher level? And to sum all of this up, would you consider reopening an overflow site or even having some nurses and doctors come in from other states as we saw early on in the pandemic?
Yeah, so our numbers are 886 patients in hospitals right now. In the spring, we had as many as 1,000 at a given time. We know it can handle that, although that wasn't easy. I expect that if our current trends continue, we will be over 1,000. So I'm concerned about all of our resources being depleted in the hospitals. At the moment, our biggest concern is the ability to maintain staffing. Even if you have a bed, if you don't have nurses to take care of them, that's a problem. We don't seem to be having problems right now with PPE. There does seem to be enough PPE, unlike in the spring. I am worried if things get much higher, they may have trouble with bed space. As far as overflow space, we do have the overflow space that we refer to as the COVID relief unit. That serves nursing home level patients. It can help nursing homes, and it also to a certain extent can be a relief valve for hospitals. And we're likewise looking for other places like that where the patients who are low acuity, who don't need the very intensive care, could be to free up a bed in a hospital.
Okay, and is there a reason why you're seeing staffing shortages right now that you can point to?
I think the reason is that every hospital in the state, every hospital in the country is being very hard hit right now. And when hospitals tend to be full, they go to staffing agencies for temporary staffing, and those staffing agencies can't find them because they're being deployed to other hospitals across the region. So unlike in the spring where the epidemic was pretty concentrated in Philadelphia, this epidemic is everywhere. So this is a subject that everyone's going to face. And I actually think it's probably worse across the rest of the state of Pennsylvania than it is in Philadelphia right now, but it's a problem everywhere.
Okay.
Maggie, are you, I think that was 3, right?
It was 2, but I think I'm
okay.
good. Thank you.
Go ahead then. I may have miscounted, but if you have one more, go ahead.
Yes, I know you mentioned, Dr. Farley, that you didn't have any numbers about the early vaccines, but you did have numbers about what you expect by the end of the year when it comes to doses. Do you have those numbers? I know you didn't have specifics on the early round.
We don't have hard numbers on that. I can tell you it's going to be in the tens of thousands of doses. It's not going to be in the hundreds of thousands, but how many tens of thousands, we don't know.
Thank you. Thanks, guys.
Right. Thank you, Maggie. Let's go now to Martin Pratt of Philly YBN. Martin?
Yes, this question is for Dr. Farley. Dr. Farley, thinking about solutions when the limitations that are upon restaurants or in gymnasiums and salons and churches are rolled back, is there any guidance from the health department as to what business owners can do to air purify their places? Have you guys been looking at some of this stuff? I've been reading about photocatalytic oxidation to destroy particles as low as a nanometer.
Yeah, so we have recommendations for what we call it ventilation, but it includes in there how they should manage their heating, ventilation, and air conditioning systems. Excuse me. And we also have that embedded in our recommendations for a variety of different settings. Now, I know what you're talking about is just sort of one specific technology in an HVAC system. I'm not convinced that technology, which is being sold as being, really important, I'm sure that's as important as it is being sold as. I think that just the volume of airflow and the idea of introducing outside air may be more important than, the filtration or what happens to the air when it's circulated through the system. So we have our recommendations out there, and we'll continue to look at that and see if those need to be altered as the science advances.
Has there been any movement regarding cloth masks versus actual K95? Have we seen any kind of new information regarding cloth masks and their effectiveness?
The reviews and the data, as I've interpreted it, mainly show that the KN95 masks and the surgical masks are the best and similar as far as their protective value. And cloth masks are not as good, but they're still very protective. And so if everyone wears a cloth mask, we're going to be doing fine. And if people are in a high risk situation, then it'd be better for them to use the KN95 or the surgical mask.
Thank you.
Thank you, Martin. Let's go now to Dale Mezzacappa of Chalkbeat.
Good afternoon. Thanks. I had a question about teachers, but I guess you answered that you don't know yet exactly when, where they may fall in the hierarchy or other educators. So, Dr. Farley, can you say anything more about the schools, how many schools remain open, and what kind of spread, if any, you have seen as a result of the schools being open?
And so we know of, there are approximately 100 schools in the city that are open. I don't have an exact number. I think in the past I said about 95. We are working with every school that we are aware of cases having been reported from in students or in staff. We work very closely with those schools to see if we can help them contain the spread there and to try to understand how it might have spread. At this point, we're up to, I believe it's 16 schools that it looks like they did have some spread in the school. It may have been 2 or 3 people, it may have been more. So there clearly is evidence that it can spread in schools. And a number of schools have had to close because of the spread, but most of the schools have not had that sort of experience.
Okay, thank you. And the other thing about the access centers, maybe you're not the right person to ask this, the mayor may know, whether the access centers are being used to capacity and whether there's been any spread in those. That's where the students go if they don't have internet at home or they need supervision during the day.
I don't have the answer to that question, but we'll get the press office back to you this afternoon.
Okay, thank you. And the other question is just a general one about schools. I mean, do you see, how important do you put having schools reopen before you're saying they don't anticipate them being open for the rest of the school year. And part of the reason is some of the ventilation issues that Dr. Farley was talking about. how much you're going to prioritize trying to get them open, or is that all just going to depend on what's happening with the virus?
I think we'll have a better idea once we get through this winter and closer into the spring as to what our situation is from a spread standpoint, and also what availability the teachers are, and whether or not they get vaccinated as a priority or not.
Would you push for them to be a priority?
I mean, I'd certainly like to get schools back open again and have it done safely. But I mean, they are a priority for us. They're not the same as a ICU nurse, but they do have priority from our perspective.
Thank you.
All right. Thank you, Dal. Let's go to Isabel Sanchez of Telemundo.
Hi there. Hola, Armando. Mis preguntas son en referencia a lo que dijo el Dr. Farley. Ya las respondió, pero necesitamos la información en español. Y realmente me gustaría que hiciera referencia una vez más sobre las dosis de vacuna en la ciudad y lo que se espera tanto para finales de año como lo que se espera para el 2021.
This is a question that Dr. Farley has already touched, but we need it in Spanish for our Spanish-speaking audience, and we would like to have your words once more about the dosage of the vaccine, the city approach to administration of the vaccine, what can we expect towards the end of the year and throughout or on to 2021.
So the city will be getting, if the vaccine is approved this week, the city will be getting vaccine next week and will distribute it to healthcare workers who are regularly exposed to COVID. Don't translate that much.
Si la vacuna se aprueba esta semana, la estaremos recibiendo la semana siguiente y se va a distribuir a los trabajadores de la salud que están expuestos al COVID de forma regular.
And I'm sorry, I forgot the rest of the question.
Yes, the rest of the question is what you expect to be happening in terms of the vaccine towards the end of this year and on to 2021.
The only other thing I'll say is we do not know at this point how many doses we're going to be getting in the weeks and months in the early part of 2021, but we will disseminate the vaccine as quickly as we get it.
Lo único que puedo decir es que todavía en este momento no sabemos cuántas dosis vayamos a recibir en las próximas semanas y meses y en la parte temprana del 2021, pero vamos a diseminar la vacuna tan pronto como la recibamos.
Armando, y mi segunda pregunta en referencia a dónde sería distribuido. Sé que él mencionó que, por ejemplo, los trabajadores de los hospitales la recibirían dentro de los hospitales. De nuevo, ya lo respondió, pero nos gustaría la respuesta en español.
And this would like to address where the vaccine would be distributed. You've already said that healthcare workers would likely get it in hospital settings. Where would be other places where the vaccine would be administered?
It could be a variety of places. We haven't worked that out yet, but we'll try to make it in a way where convenient sites for people to travel to.
Todavía no hemos decidido dónde se van a administrar estas vacunas, pero va a ser en lugares que fueran convenientes para que la gente pudiera llegar a estos sitios.
Thank you so much. Appreciate it.
You're welcome.
Thank you, Isabel. And let's go now to Mike Donofrio of the Tribune.
Hey, everybody. Thanks. So I just have three questions here. Has the administration, I know you kind of already touched on this, but has the administration developed a plan for when residents and staff inside correctional facilities and detention centers will receive the vaccine?
They would generally fall in the category of essential workers, critical infrastructure workers. And so that's not in the very first group, but that would be likely in the next group.
And just to be sure, because you said workers, are inmates included in that list as well?
That inmates would fall in the category of people who live in congregate settings. And people who live in congregate settings are in phase one. Exactly where they're going to be in phase one, I think, is yet to be worked out.
All right. And if you could just maybe reiterate, does the administration believe the first distribution of the vaccine should include inmates, residents in these correctional facilities?
I think they're important, and it's important to do them soon. I just don't want to commit to that right now because I don't know the plans of my staff that are working this out.
All right. And then I guess just lastly, have there been any deaths in correctional facilities this year due to COVID? I can't remember.
Hey, Mike, we are actually joined by Prisons Commissioner Blanche Carney. Commissioner Carney, are you able to turn on your microphone and video and can address that question.
Yes, thank you, Mr. Dunn. Commissioner Carney, we've had one inmate death related to COVID-19 and one employee death related to COVID-19.
Okay. I guess that's 3. Thanks. Frozen here.
Mike Dunn, you there?
Yeah, I apologize. I need failed to unmute myself, but let's go now to Pat Loeb of KYW Radio. Pat, you're up.
Hi, this is also a prison question. Will you be offering testing for guards or even mandating it for guards given the surge in the prisons? Commissioner Carney, Dr. Farley, tomorrow, I'm not sure who wants to answer.
Good afternoon again. We are exploring that option for testing. We're exploring that, yes.
Okay. And I guess, Mayor, or tomorrow we hear the flower show will be moved outdoors this year because of COVID. This is an important tourism event for the city, and I wondered if the city was in on the plan to move it to FDR Park.
I know about the plan to move it there. We're supportive of it. I don't have all the details yet as to where everything will be situated, but it's a lovely place to have it, and hopefully we'll hope for good weather.
Okay, those are my questions. Thank you.
Okay.
Thank you, Pat. Let's go now to Sean Walsh of the Inquirer.
Thanks very much. First question is for Dr. Farley. You touched on this a little bit, but could you describe sort of end-to-end the chain of custody for vaccines that will reach Philadelphia? Is the city the middleman, or does it go directly from the CDC to Philadelphia hospitals, that type of thing?
My understanding is that it is stored at the manufacturer, and then it goes from the manufacturer through a distributor at the direction of the CDC to us here in Philadelphia. We will receive it here. We will distribute it. We will store some of it ourselves, and we'll store some of it at hospitals around the city. And then the vaccination sites will get it from either us or from those hospitals where it's stored at.
Gotcha. Thanks. And for the mayor, I hope you are doing well in quarantine, that you don't have the virus. But we were curious if you were exposed to this through someone on the job or in your personal life. Was this while you were?
I'm not going to disclose the contact. It's not fair to that person.
Okay, gotcha. And then last one for Dr. Farley. Sorry, let me just pull this up here from another reporter. Oh, yeah. Can vulnerable people in the general population with underlying health issues or advanced age, should they expect to be possibly receiving a vaccine by the end of the year or soon thereafter?
Not likely by the end of the year. They're, I believe, in phase 2. As much as we know that people are vulnerable and they're reasonably concerned, there are many, many people in there. A very large percentage of the entire city falls in that category. And so we're going to need to have a lot of vaccine in order to cover those people.
Great. Thanks very much.
Okay, thank you, Sean. We're going to go to Denise Clay, but I just wanted to note that after Denise, we have a few minutes for questions in a second round. But for now, Denise Clay of the Philadelphia Sun.
Yes, my question's for Dr. Farley. You were talking a little bit about the staff shortages that hospitals may be experiencing due to folks being used in other places that you would normally get from staffing agencies. Has there been any thought of reaching out to the medical schools in the city, since we have quite a few of them, and seeing if maybe people who are about to finish up their studies and are, looking for an opportunity to apply their craft using those students?
I think that probably the first staff that are likely to run short are not doctors, but nurses. But I take your point, and I don't know. You'd have to talk to the hospitals and see whether they are tapping into nursing students in addition to regular nurses.
Okay, thank you.
All right, thank you, Denise. And seeing no further questions, thank you, everybody. We will continue these next Tuesday, December 15th. Thank you.